Okay, here we are from CHIME. Nick, do you want to introduce yourself?
Hi, my name's Dr. Nick. I'm the incrementalist, and I'm an emergency room physician, and I focus at the intersection between technology, healthcare, and business.
So when we first met, you're very active on social media. When we first met, you were with Dell. So you're now on your own.
Yes, so I'm running my own company. Sounds rather grand, but this is it. You see all of it. Offering strategic advice, trying to find those small improvements, revolution through evolution. Don't let perfection stand in the way of progress.
Oh, absolutely. You can't innovate if you're looking for perfection or, big bang kind of stuff.
And it's the lowest risk approach, because if you make a mistake and you're trying to make for that big leap, that's a really costly mistake. Whereas if you go for those small steps, and all the exponential companies all started with these incremental improvements, Uber, Airbnb.
Yeah. So you, do you consult with providers, payers, pharma, startups? I mean, where do you?
All of the above.
Okay.
I'm very fortunate in the 30 plus years that I've spent at this intersection point, that I've been involved in companies that come from the small, the large, from multiple backgrounds. And as I put it, I have multiple arrows in my quiver to shoot at all of these opportunities.
Yeah, physician background, technology background, and the innovation side can always use that perspective, because you have all these people coming in from Silicon Valley saying, we think we can change healthcare, and they can, really. I mean, what did I just say? I just read $2.5 billion was invested in healthcare in January.
I'm not surprised by that, but I would strongly advocate the involvement of clinicians in anything involved in. If you've got health anywhere in your company name or activities, if you don't have clinicians involved, I think you're missing the mark, or you're going to potentially miss the mark. That's an expensive mistake to make.
So I'm going to ask maybe a dangerous question here, but could traditional clinicians lead you down a wrong path, though?
I think that's a fair comment. If you get stuck in the history of medicine and the way that we practice medicine, electronic health records are a great example of that. I mean, what did we do? We essentially digitized the paper system.
Right.
That wasn't the smartest thing in the world to do.
Right. But, yeah.
And if you think about the physicians, that's what they would have said. Well, this is how we do it. We should go and, So there has to be some innovative thinking, and you have to push people in that direction, some folks. Yeah. Others like me, I see 25 years ahead. I was doing population management at school as my sixth form science prize.
Wow. So let's talk about this conference. So HIMSS is interesting. How do you do this conference? What are you looking for at this conference?
So I just want to say that's the understatement of the year, but otherwise, it is. It's the biggest aggregation of healthcare, technology, innovation, all of these folks coming together. How do you plan?
45,000 people.
Right. How do you plan? How do you involve yourself? So I always come with a plan, but pretty much almost as soon as I arrive, I throw that plan out the window. There's elements of this that are random, and I think you have to accept that. Look for sort of small areas of focus that you're interested in, individuals that you're interested in meeting. It's a great opportunity. It can be challenging to do. And then find those opportunities where you can learn from others and engage with others.
So are there trends that you're going to be keeping an eye on, that you're going to be looking at those technologies?
So I think we see an awful lot of the trends around artificial intelligence. You just have to look at the numbers of sessions to know that cybersecurity is a top pick. Artificial intelligence, population analytics. So all of that gives you a sense, in my mind, of if you think about the innovation cycle, they've all sort of moved over the peak of disillusionment, and we're sort of moving, we hope. I try and pick some of the things that are further out. Where is technology going to take us? What are the opportunities? One of the foundational things that I think is really going to hit us very hard is around sleep and sleep innovation. When I went to medical school, I was doing a 136-hour week. There's only 150 something in the week, so that's a lot of hours. Huge sleep deprivation. It was clear that was a major issue. We failed to focus on that sufficiently, and it's not just a pillar of health, it's the foundation of health. How do we fulfill that obligation to our patients? Because one bad night of sleep is worse than missing your exercise for a week or eating 5 Big Macs every day.
And we heard this morning in the CHIME session, we heard about isolation and loneliness and its impact. Essentially, the impact of loneliness is the equivalent of creating a chronic stress state in the body. And, and lack of sleep is that also that other thing.
So, and that's a great point. If you think about loneliness, that's one of the tortures that are used in warfare. It's an awful concept, but given that that's an effective torture methodology, we have to find means of communicating and connecting. And the thing about technology, one of the things that you'll see in Japan is they've led the way with some of these robots and innovation. And whilst that's technology, it turns out that that's actually companionship. It's no different to having a pet. Not everybody can have a pet. We could all have some kind of robot that interacts with us, makes us feel good. Simple solutions. And it's interesting because sometimes you see those videos of the robot and whatever, and you almost you chuckle at it.
But then, my father-in-law comes to live with us. He's 87 years old, and he's interacting with the Echo like it's his companion. And it almost is. It's like, hey, what's going on in the news? What's going on in sports? Hey, can you play me some country music? I mean, he's interacting with it all day, and that's not even a back and forth.
Right.
But
I think the important part of that is that you imbibe an element of personality in those artificial agents, whether it's just a speech element in the case of the Echo and Amazon Alexa, and you give them a sense of you. And one of the things that happens in these interactions is I know something about you, I've got some of the history, and I apply that to our conversation. If you do that with technology, it starts to be more engaging. It's more human-like. You can't replace humans, but you can augment them.
Well, let's talk about providers. So, one of the things about providers is they could potentially get pigeonholed in terms of you're going to be our place to go for episodic care and those kind of things. But they have this opportunity to be the trusted partner in their communities if they can figure out how to break down the walls, right, and engage the community, engage people in their homes and those kind of things. Are there different technologies you're looking at that a provider system is going to be able to make those transitions? Because we're seeing the other players try to. I mean, you're seeing the JPM, Amazon, Berkshire. You're seeing just CVS, Aetna. You're seeing other players saying that's where we're going to go. Are providers going to be able to get there?
So I think what's old is new again in my mind. So when I was practicing medicine, we would do home visits.
Right.
We were embedded in the community. Why did we stop? Well, it was a cost issue. It was a challenge from a coordination standpoint. And you see some of the companies like CareMore who are inserting not just the physician but all of the other groups into the community. I think it's an essential component. The way that technology helps is not by replacing but augmenting. So instead of, you've got a limited set of resources. So we triage, the same as I did in emergency medicine, you triage the patients coming through and deal with the ones that you have to deal with urgently. Same with this insertion into the community. Find the ones that are desperately in need, focus on those, you reduce their costs, improve their health care, do all of the good things, and then you can focus on the others. You've got more resources left as a result of that. So I think it's the combination. People are terrified of this technology, but technology isn't going to replace us. It allows us to do more and to process more information and deliver the best possible care all of the time.
So last question, culture, right? So I worked for a fairly large health system for about 8 years. The culture of healthcare sort of just keeps going in a direction. How do you... It's not that there aren't innovative people within healthcare. There was a ton of innovative people. But how do you gather those people and create a movement within maybe a very traditional trajectory of a health system?
So I sometimes use this analogy, and I'm always a little bit concerned when I do because it has some negative connotations, but it's a bit like plutonium. Plutonium's kind of interesting, dispersed, but when you bring it together, you create something incredible and impressive. And I think it's the same with all these resources. Nobody goes into work with the intent of delivering poor care and not caring about patients. It's just not the way that we were brought up. The individuals aren't built that way. So you have to facilitate the bringing together of those resources in an environment that encourages it. I'll pick just one simple example. instead of this punitive approach to medical errors, taken a page out of the airlines. And I know they're imperfect, but for the most part, it's a no-fault activity. We just saw a case just recently of a nurse being prosecuted for a mistake that was made post an EHR implementation and an error. Did she come in intending to do that? I don't believe that for 1 second. We have to find ways of supporting so that people feel confident to contribute and to enable them. That for me is really, you've got all these resources, we just have to tap into them. They're desperate to deliver the best that they possibly can.
Yeah, absolutely. Nick, thanks, but I do have to get a shot of the back of your jacket. Is there a story behind the back of your jacket?
There is. So this is the walk-in gallery. I'm very passionate about it. Regina created this. It was initially as, a painting on a wall, in fact, and every jacket tells a story about an individual's journey and struggle. In fact, it's ironic that you picked this, and I'll allow you to focus in. So the story is me, so the hourglass and the sun and the moon represents time. The people in front of it are all my colleagues that I worked with as a junior doctor. That's me, I think, at the front. And then the lady on the top is a friend of mine who committed suicide as part of that whole process, couldn't cope with 136 hours and other things that went on. We all have a story to tell, we've all got a passion. I was enduring sleep deprivation that was good for me in the days that I was experiencing it. The concept of this is to have people have that conversation. I was just at breakfast in a hotel, and the receptionist there asked me about it. I got an opportunity to share the story. That's the purpose. Yeah. My hat's off to Regina and the walk-in gallery. It's such a fantastic
that's phenomenal
experience.
Thank you for your time. Really appreciate it.
Really enjoyed it. Thanks.